there are often no signs and symptoms of prediabetes or diabetes. That usually happens for, of course, type 1 diabetes, or after years or decades of having diabetes. And so if you don't have symptoms and you feel fine, there aren't really resources. Um, and we know that there's a high rate of undiagnosed prediabetes and diabetes. So that's very likely the case.
And you said no, there's no like there's sometimes there's like silent signs and symptoms for like pre-diabetes and diabetes. Is we mentioned that pre-diabetes is completely preventable, but is type 2 diabetes preventable at all or like reversible whatsoever? Are there cases in where you got diagnosed with type 2 diabetes and you completely reversed it? And we know that type 1 diabetes cannot be reversed, just as a reference, because it's genetic. So for type 2, have you seen people that maybe have reversed course, or is it just more of just like a management thing from here on out?
Yeah, so I think it's becoming more and more clinically accepted to talk to patients about not necessarily reversal, and maybe it's just a semantic difference, but diabetes remission.
Mm.
It is not very common, but again, I think it's becoming more acceptable to start talking about it and start looking at those factors. Um, there was a large study involving over 120,000 people, and 1.5% achieved remission. And remission is defined as blood sugar levels in a subdiabetic range without the use of medications or surgical intervention.
Mm.
So 1.5%. And that's not to say it couldn't be higher. We don't know, I don't know at least, what the resources were, what like the active push for helping people achieve remission was. But we know it's not very high, like as of now. But I do think that it is mechanistically possible, especially in the earlier stages of the diagnosis. So again, going back to that kind of progression, at a certain point, I am not sure that all cases of type 2 diabetes are reversible.
Mm.
But the earlier you are in that progression, you still have better beta cell function, lower insulin resistance, lower and maybe lower insulin levels, or maybe they're still high. It kind of varies. But at least looking at beta cell function and insulin resistance, we can impact those. People can impact those with changes. We know that in the earlier stages of the disease, the pancreatic beta cells that don't produce enough insulin aren't permanently damaged, and they can be restored to normal function primarily through the removal of excess fat
Mm.
storage. And then insulin resistance, that decreases with weight reduction, exercise, changes in the diet, stress management, improved sleep quality, all of those different things. So mechanistically, it's possible. It's just quite rare. I have personally seen some patients, a handful of patients achieve it, and they were diagnosed early. They were not started on medication. And that's not to say that medication itself obstructs the ability to achieve remission. It's just more of a marker of where somebody is in their progression of the disease.